Hi, Professor Jones. It's Pauline, and I'll be simulating the NG2 placement skill video today. I start by verifying the doctor's orders, making sure I know what type of size and type of NG tube I would be placing. I would also check the patient's history for any nasal problems and any anticoagulation problems. And if everything's all fine, I'll go ahead and do the placement. I start by gathering my material, doing hand hygiene, and then getting my material. I'd go into the patient's room, provide privacy, introduce myself. Hi, I'm Pauline. I'm here to insert an NG tube. I need to identify the patient with two patient identifiers by asking him his name. What is your name, sir? Harry Jones. Harry Jones, what is your date of birth? 1555. Okay, everything's checked. Like I said, I'll be doing vital signs, and I'll place a pulse ox on his finger, make sure everything is okay and to go. I then check the patient's, have the patient cough, and check his gag reflex. Okay. So he has good cough skills and he gags. Those are all positive. Then I would check the patency of each nair to make sure it's clear, and then also that can determine which side nostril I'll be using. So he check it by blowing, and then the other nose. Okay, so since I'm on this side, I'll be using his left nostril. So again, I do my hand hygiene. I apply my gloves. It tore. I would actually do another pair of gloves because it tore, but this is just a regular cleaning technique. And I would take my nasogastric tube, prepare my equipment preparation for the nasogastric tube placement. I clean up my equipment. And I would take the nasogastric tube and I would measure from the tip of his nose to his earlobe, and then from his earlobe down to the xiphoid process to see how far I would be going down into the stomach region. Okay, once that's verified, I take my marker and make a little mark on there. This is to remind me how far I'm going down. I have my lube there. I take the lube. And at this point too, I also have an assistant coming to help me, and that assistant will be giving the patient water as I'm inserting the nasogastric tubing. So I'm going to lube my nasogastric tube, and then I would take it and push it, gently push it, insert it towards the back smoothly, so it's going in and then it go down. As I'm going down, when it's coming down the throat, I'd have the patient tilt his head forward for easier insertion. And once I get about 25 inches down, I would have the patient open his mouth and make sure it's in the trachea. That means not in the trachea, that I see in the back of the throat. And I would check for, make sure there's no air, just make sure I don't get any air bubbles, so I know I'm right in the right place also. And if there's no air bubbles, I'll continue to go down. Okay, so now I've hit my notch. So I have the temporary piece of tape. I'd be having assistance. I place it in the tape over here just to hold it in place temporarily. At this point, I can remove my gloves. And then I better anchor the tape down to do another piece of tape. About 10 inches. And I'd get some type of sticky adhesive so that I can stick the tape over here. This is my adhesive. And I would take the tape and anchor it. And also remove, I'm doing this one, I'd remove this piece. Wrap it around. Then I take the other piece and go the opposite direction. Oh, my head is falling. It's not the best head. Then I take the other piece of the NG2 and I tape it to the gown and make sure right here, my mark, and I have the patient, for proper placement, I'd have the patient go to the x-ray area for x-ray, make sure it's there. And once the patient returned, I will provide oral care, and I would clean the side of his face with a washcloth just to get all the stickiness and any kind of drainage around him, just clean him up a little bit. And then once that's all done, I'd gather all my material, and I'd let him know, are you okay? Everything, do you feel fine? Do you have any discomfort? Everything's okay. I take my equipment with me, leave the room, perform hand hygiene. Then I'd go and document the procedure, placement of the tubing, how the patient tolerated it, and if there was any complications or anything, I document that also. But I will document the most important thing would be the placement of the tubing, how the procedure went, and how well the patient tolerated it. And that's how I would do my insertion of my NG2 placement. Thank you.